Hello, everyone. It's a beautiful day. It's another exciting edition of ATP Live. We're excited and we're happy to have you. It's been a wonderful year for ATP, and thanks to you all for making ATP where we are today. And today we'll be talking about a very interesting topic, something that I am actually very interested in as well. It's ADHD, Attention Deficit Hyperactivity Disorder. And with me is Dr. Bemisola Boyede. Dr. Bemi is one very passionate person about the survival of every child, not just the Nigerian child. I I I envy your passion. Dr. Bimi, good morning, welcome.
Yeah, good morning, everyone. Thank you so much for joining us this morning on Ask the Pediatricians Live. And yes, the topic we're talking about today is one of those topics that is dear to me because that's one of the uh, my area of specialty. So we're going to be talking about attention deficit hyperactivity disorder, or ADHD for short. So thank you so much for joining us, and we encourage you to kindly share this video on your timeline, to your friends, your groups, and invite them to come and join us so that they can learn a thing or two. And if you have any questions for me on this topic of ADHD, kindly drop it as comments, and then we'll feature it, and then we'll be able to answer the questions as much as we have. We have only 1 hour, so try and make sure you join us early and drop your questions so that we
Yes.
don't have to start rushing towards the end. Thank you so much. Good morning.
All right. Thank you, Dr. Bemi. And I must apologize. Sorry for starting a little bit behind schedule. It was beyond us. So I hope apology has been accepted. All right, we're going to go straight into the topic. But at the same time, I'd like to tell you to please share the video, encourage your friends to come online so they can watch and learn and, and ask their questions, as many questions that you want to ask. Dr. Bimi is here to take our question. I remember she said this is our area of specialty. So get ready for all your answers. All right, Dr. Bimi, ADHD. Hmm. Can you give us a brief overview or what exactly is ADHD?
Okay, thank you. Okay, so when we talk about ADHD, the full meaning of the word ADHD hyperactivity disorder, and it's a disorder in children. It can also affect adults, but most times we are talking, this is ATP, so we're talking about children here. So it's a condition that tends to affect children, and in ways that the children have difficulty with concentration, maintaining attention, and and sometimes they could be very hyperactive, and this will affect them to a certain extent that it will affect their ability to learn in the classroom, and also to be able to function in other settings. So these are that. So when a child has this kind of difficulty with maintaining concentration, or the child is always very busy, always hyperactive, and these features is significant enough or is impairing that child's ability to be able to um, uh, cope academically or with other interaction with family members and or in social settings, then we see that child has attention deficit hyperactivity disorder. I'm trying to avoid using jargons. I'm trying to avoid using medical terminology that can make people confused. But
Confuse us.
exactly. But let me break it down a little bit more. No, there are certain things that must be present, because I see a lot of mothers coming to me and say, "Oh, this my boy is very active, he's very hyperactive. So does he have ADHD?" And they wonder whether the children have ADHD or not. Um, let's start saying that it's not every boy who is very active that has ADHD. You understand? So, and it is not, and some people think that because girls don't, they are not very hyperactive, always jumping up and down, that they don't have ADHD. So those are some of the myths that we often need to often get rid of. So it is not every hyperactive quote, child that is having ADHD, and it's not every child who is just docile, who is not moving up and down that doesn't that means that child doesn't have ADHD. So that's the first thing. Number two, so ADHD can affect both boys and girls, even though it's commoner in boys than girls, but it can affect both boys and girls. And there are different types of ADHD. So we have what we call the predominantly hyperactive type. So those are the ones that the children are always very active. They jump, they're always on the go, like the motor is driving them and things like that. And you also have the children who have what we call predominantly inattentive type. And this one is the one that tends to get mixed, or people don't tend to diagnose it, because it's not like the children are disturbing and all those kind of things. But the children are often lost in thoughts. They're often forgetful. So, and this is the type that sometimes we find it very difficult, especially to pick up in girls. So you tell them to do something, they've forgotten it before they left, before they walk like 1 minute, they've forgotten, then they come back to you, you're asking, sometimes they seem to have been lost in thought, sometimes they seem not to be paying attention, they are forgetting things at school and things like that. So those are children with the predominantly inattentive with the children. You also have what we call the combined type, so where the children have both the inattentive and the hyperactive ADHD. So there are different types of ADHD. That's another thing we need to understand. And number two, so being forgetful, not concentrating, or being hyperactive on its own does not make a child to have ADHD. That's those characteristics must impact on the child's function. It must be impairing the child. It must be affecting the child academically and all that, or it must be affecting the child in times. Even for adults, it could be affecting them at work, or it could be affecting the child's social. So it must be impairing the child's everyday life for us to now say the child has ADHD. And then these features, this behavior pattern must be present in more than two settings for us to even say the child has ADHD. In other words, it is not enough for the child to have it only at home. So there are people that say, "Oh," but some people will say, "Oh, this child," the teacher will say, "Oh, the child is very well behaved at school," but the parent will like, "Oh, the child is very hyperactive." And then sometimes the parents will say it's the other way around, that, "Oh, the child is very well behaved, does very quiet, very cooperative at home," whereas the teachers are having a nightmare at school. So it must be so for, and in that case, that means we have to look. Is there something present in this environment that is making the child to behave this
Yeah.
particular way? So that is we don't make, so for us to make a diagnosis of ADHD, the behavior must be observed by in more than two settings. Either we usually look at school and the home environment. We can also look at work environment for adults. We can also look at church and things like that. So usually when doctors, pediatricians want to make a diagnosis, we send questionnaires both to the teachers and to the parents. And they must sometimes usually agree before we are really convinced that the child has ADHD. So these are the main features that must be present for us to say a child has ADHD. So I see a lot of mothers asking questions. My boy is very hyperactive. He must have ADHD, and sometimes like that. And another thing I really need to stand while we're still before our question. So just to say, you can drop your question, we'll feature it, but I've not seen any questions, so I'll keep on with our general overview. Another thing that we must say about ADHD is the fact that there are lots of developmental disorders, many disorders, and sometimes these disorders look alike. So sometimes parents think, but parents like to go for the one that is kind of easier to,
So,
to go with. So I see a lot of children who has other developmental disorder, for example, autism spectrum disorder and things like that. And parents will say, oh, the child has ADHD, or even other professionals, doctors who are not much into development,
specialized.
into developmental pediatrics aspect and all that. They will say, oh, the child has ADHD, whereas the child has autism. So, for example, some people say the child is being and all that, then they will now say, oh, this child has ADHD and speech delay. Usually, most time when you get that kind of mix mixture
Combination.
combination of diagnosis, most likely that child has autism, because usually children with ADHD, they are otherwise normal in terms of their development. So they are not slow talking, they are not slow with other things. So in fact, most times, though you could also have ADHD coexisting with the other developmental
Disorder.
disorder, because in this field of special in our specialty of developmental pediatrics, what we call comorbidities, that is two conditions existing together, is the norm rather than the exception. In other words, it's common for you to have a lot of children having not just ADHD, but they can have ADHD with other things.
With
So
other
yeah,
things.
so sometimes it takes a specialist to be able to say, okay, it is this. Sometimes we make a diagnosis of autism, then later we say, oh, the child, in addition to the autism, also has ADHD. Because there are some parts of autism that looks like ADHD as well. The behavior pattern can look alike. But you will notice that for children who has the autism and the ADHD, the behavior of the ADHD is way far above what you would expect normally for a child who's just having autism spectrum disorder only. Yeah, so those are the different patterns. So if you are not sure, it's better to make sure that you go for a proper evaluation to have a diagnosis of ADHD. Yeah, thank you.
Thank
Thank
you. Thank you,
you.
Dr.
Thank you, Dr.
Mimi. That
Baby.
was very educated. All right, so don't forget to invite your friends, share the video so that they can watch and then ask their questions. We're waiting for your questions, but before we go there, Dr. Bimi, I've been hearing about ADD and ADHD. Is it the same thing or are they different?
Okay, yeah, ADD, attention deficit disorder. The diagnosis of ADHD has undergone a lot of um, the name or the terminology itself has undergone a lot of changes over the years. So there's a time we tend to call it ADD. There was a time we were calling it hyperkinetic disorder. It has had different names over the years, but basically they are all the same. But right now, the accepted name terminology is ADHD. That is attention
ADHD
deficit hyperactivity disorder here.
disorder. Okay. Dr. Bimi, I'm a teacher and we
Yeah.
experience so many things. You know what? We can be so quick to assuming that a child, ah, maybe this child has ADD or ADHD because of their inability to focus or concentrate on the task at a time. I want to ask, how exactly can we tell, or how is it diagnosed? How can we tell that a child has ADHD?
Okay, yeah. So I know that most of you that are teachers, you tend to pick up the children a lot more because especially in this day we're living, where most parents don't have that time with the children, so they are out in the morning, and it is the maids or whoever will bring the child to school and things like that. So it's not unusual for it to be that it is the teachers that tend to see some of these behavior pattern. So to make a diagnosis of ADHD, so there are what we call criteria. So we have what we call criteria, and this criteria is recommended because the diagnosis of ADHD is not like malaria, for example. So we don't send a blood test to the lab. So we don't send there's no blood test, there's no X-ray and things like that. So these are things that diagnoses that are based on behavior. Now, like I said earlier in the introduction, some of these behavior are normal. So, for example, a child being hyperactive does not mean the child has ADHD. Generally, boys are a little bit more adventurous than girls. And it's not every boy who is adventurous who like to run up and down and things like that has ADHD. So because of that, there are certain criteria that must be met. So there are certain things that we must tick and say this child has this, has that, and then he must meet certain number of these criteria under hyperactivity or certain number of these criteria under inattention, and then this behavior must be affecting the child in terms of academic performance. So you see a child who has, when you do the IQ test for them, they actually have very good IQ, they are very intelligent, but when they, in terms of the academic performance, there's a gap. So the teacher think this child is very intelligent, but because the child will not complete the work, the child will not finish the work, will make silly mistakes and things like that. Then, or the child will not, the child will not do the homework. The child will not return the homework. The child will not even go home with the homework and things like that. Then the child will always be scoring lower than what the child ability is, the capacity of that child is. And then it's on the presence, not only in school, but at home. So we need to have all these criteria checked. And before we can now say, yes, this child has ADHD. So usually we have some, what we call questionnaires, some instruments, we call them, that help us to be able to make this diagnosis. So usually we send the questionnaires to the parents. We also send it to the school, and then we collect it. So those questionnaires, they have so many questions, and we ask them in a way that it won't be predictable and all that. So we have different types. We have what we call the Vanderbilt. We have what we call the Kerner questionnaire. The reason why I'm really taking time to explain is that so that when you get some of these forms or questionnaire from the pediatrician or from the school, you don't just assume that excuse me.
Oh, mommy, I already did the first picture.
Excuse me. So you don't just assume that the child, you don't just assume why are they disturbing with this questionnaire, because it is after we finish, it is when we get all those responses back from you and back from the school that we can put it together to make a diagnosis. So it is important that you fill the questionnaires as accurately as possible. Sometimes parents are thinking, oh, my child is not this bad. They don't want to, they don't, or sometimes even some teachers, when you send them the questionnaires, they are being careful not to, they don't want to make like if they are saying bad things about that child. It's not about saying bad things about this child. It is just about making sure that this child has the right diagnosis and get the right help. So it is better to tell us what it actually is. Because sometimes you see questionnaire from the parents, everything is zeros, everything is perfect, and like you are wondering, this child that I'm seeing in front of me, this child and I'm seeing in front of me cannot be this. I mean, if the child is this good, why is this child here in front of me? You understand my point? So it's important that parents fill those questionnaire appropriately, and so that you can, because sometimes when we don't get the right responses from the parents or from the teachers, we will not be confident to make that diagnosis of ADHD. But in our own because we can't make that diagnosis only by our own observation, because that child is only with us for maybe 1 hour. But the child is with the parents for more than 24 hours most days. The child is with the teachers more than 8 hours, 5 days in a week. So they have more opportunity to see the child rather than the pediatrician who is only seeing the child for 30 minutes or 1 hour max. You understand? So we really need that feedback from the parents and from the teachers. Yeah, so to really be able to make that diagnosis. And it's important. So the diagnosis is based on those the child meeting those criteria based on the responses we get from those our questionnaires. That's how to make diagnosis. Yeah.
All right. Thank you, Dr. Bimi. I'm learning a lot, and I hope you're learning something. I want you to keep the questions coming and share the video, invite your friends, and everybody watch this. This is something that I see almost every day because I'm a teacher, and I've learned so many things, and I'm going to take this thing seriously now. So when we see these questionnaires, we'll not just fill them for feeling sick, we'll fill them with serious mindedness.
Yes, very important.
Another question very quickly. Can ADHD be treated?
Yes, of course. Yes. So that's what we're talking about. Is thank God it's one of those conditions that can be treated or that can be managed. Okay, and even some of the others that are listening to me, some people have ADHD. Let me just say by number, before I go into the treatment, I forgot to mention that earlier, is the fact that the ADHD usually, we don't know the cause of ADHD per se, but we think it has genetic, there's some genetic association with it. In fact, majority of the time in children with ADHD, there's always a probability that there's either the father or the mother also has ADHD, or there's a family history of ADHD as well. So I've had instances where parents bring their children to us for diagnosis of ADHD, and you can even see from the way the mom or the that they also have ADHD. And some of them are actually very honest about it and say, yes, this child was a lot like me when I was also at this age. But because, as adults, they've learned how to kind of learn how to manage them. But most of us, we know this of our friends that we know that I think we have ADHD. So there's always some genetic part of it. But we also know it's associated with things like maternal smoking, babies that are born preterm and things like that. There are a lot of or taking alcohol during pregnancy and things like that. But we don't really have like this is a specific thing that causes ADHD. But the one that we are very sure about is that it's mostly inherited. So usually we always ask, is there any other person in the family who has this diagnosis? So that's about the cause of ADHD, because I know some people may be interested in that. And then going on, we talk about you're asking me about the treatment. So the first thing is for us to know, to confirm the diagnosis of ADHD, because there are so many things, like I said, that can look like ADHD. For example, children who has sensory impairments, for a child who is blind or a child who is deaf, sometimes they look like they are not paying attention, but sometimes people don't know that it's because the child could not hear. So usually we normally like to do hearing tests. Or sometimes a child is not concentrating or a child is acting out in class, maybe because the child could not see the board very clearly and the child just think, oh, let me just disturb them as a way of getting back. So those are some things that we need to roll out. Sometimes some children who has inattention, what we call absent seizure. There are some children that tend to look as if they are not concentrating, they just kind of zoned out and all that. Some of them are actually having seizures. Yes, they're actually having seizures. There's what we call absent seizures, and it could really look like inattentive ADHD. But you see that the child will be talking, for example, and just pause in the middle of the sentence and then just go on. And then after a while, just continue as if nothing happened. And you wonder what happened to the child, or the child is just, and this can happen several times in a role in a day, and so that child is missing out in between what the teacher is saying. So the child does not have so those kind of children may have seizures that require treatment. So these are things that look like ADHD, but they are not ADHD. And of course, I've mentioned that other problems like autism and things like that, they can also look like as if the child has ADHD, because some of them comes up with behavior issues, but it's not necessarily ADHD, though they can also have ADHD in addition to autism. Children with intellectual disability at times, because what you're saying is really above their head, they don't really understand. So that's why one of the things we also check when you're doing diagnosis is also to do the children's psychological assessment, psychometric assessment to know their level of intelligence and things like that. Anyway, so we need to be very, very sure that this is ADHD and not any of those what we call differential diagnosis or the look-alike of ADHD. So that's the first thing we do. So after we've convinced ourselves that this child has ADHD, what in terms of the management, we have what we call the behavioral management, or pharmacological or drugs management. And let me say, the first thing that we don't, the first thing is not to go into drugs, because even those parents always think, oh, just give him something so that the child will be calm and all that. But, in addition to even when you are using drugs, you still need those behavior management. So parents training is one of the first thing we do. We need the parents to understand what ADHD is all about. We need the parents to understand why the child is doing what the child is doing and things like that. So it's very, very important. So parents need to understand ADHD, why the child has ADHD, what are the features of ADHD, how does the brain of an ADHD child works, how do you handle it, how do you get them to behave properly. So behavior management, parents have to be trained. So there's always, and there are a lot of usually groups, support groups for parents of children with ADHD, or people that teach them about behavior management, parents training, parenting classes and things like that. It's very, 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 very helpful. And sometimes some children with that alone, they may not even require any form of medication, because with the behavior management they'll be fine. And teachers also need to be part of that behavior management. So usually we tell the teachers as well. So they also, what is the baseline of that behavior is that you try to, what are those things that the children are doing that you really want to want them to get over. So you don't make too many goals. You can just say, okay, let me address 3. Okay, maybe the child is always interrupting you during the classroom, or the child is not finishing his homework, or the child is getting things lost. So you can decide to address a few of them at a time. And then usually the way we do is that we reward good behavior. We can tell the child, if you're able to, do this, so if you're able to finish your own work so number of times, then you get this reward. There are daily reward, there are weekly rewards, there are rewards, long-term rewards and all that. And then you try to encourage the child. And also when the child doesn't do it right there, so the child may lose some privileges. So I'm just giving us an idea of how we go about behavior management. But we make it short and then we can graduate it. For example, there are also some modification teachers can make in the classroom. For example, a child with ADHD is the child that you want to sit very close to you in the class. That should not be the child that should sit at the back or near the windows where they can easily be distracted. So you want them sitting very close to you. Sometimes when you give them responsibility, you make them the assistant teacher or assistant captain or something like that. It helps them to kind of control their behavior better. So those are some of those behavioral strategies that parents, teachers can use to help children with ADHD. But sometimes, even with that, it may not be enough, and then you really need to use medication. So we have what we call medication for ADHD, and we have what we call, there are different types. We have what we call the stimulants medication, like Ritalin and all that. Then you also have the non-stimulants and all that medication. I know there are lots of misconceptions. Some parents are worried about medication, the side effect, that it will make the child look different. But usually when we start seeing medication, the pediatricians will be with the child, will be walking through. Usually we start with very low dose of this medication. And sometimes parents are also very impatient, because you start with a small dose, they've not seen any difference, then they start getting out. The medication doesn't work, they're going to throw it away. No, you need to be patient, because for this kind of condition, most times the drugs is not according to their weight or anything, it's according to their response. So we usually will start very slow, and then we'll gradually increase it until we get what works for you. So a smaller child may need a higher dose. It doesn't matter. Whereas a bigger child may just even need a small dose. So it is according to the response of the child. And those drugs doesn't mean that the child has to take them for life. It doesn't mean the child will have to take them for life. So sometimes during the holidays, we can stop the medication and see whether the child is able to control their behavior. Remember, we are not just only doing medication, we are doing medication with the behavior management. And the behavior management is very important. Behavior management is important for everybody. We all need to know how to organize ourselves. We all need to know how to do time management. Just that for children with ADHD, they need this even more than the average child. So whatever behavior strategies you use, even for your children with ADHD, it will be very helpful even for children without ADHD as well. So these are the ways by which we manage ADHD, and of course the doctors. And sometimes some children with time they learn how to manage themselves, so they may not even need medication, but some may need it during the period, maybe when they want to have their exams and they really need to have lots more concentration. And another challenge with the drugs with ADHD is that they are drugs that can easily be abused. And because some people abuse them, some drug people, they take them. So because of that, they are very regulated drugs. And sometimes they are not easily available. This is the major challenge for those of us in this part of in sub-Saharan Africa, because the drugs are very regulated. It's very difficult. So most pharmaceutical companies don't want to stock them, but they're beginning to get them these days. So that's good. So just to know, so that parents don't get discouraged if they're having difficulty getting the drugs, but with your pediatrician support, you can always get it. So the best pediatrician to see if you think your child has ADHD is a developmental pediatrician or the pediatric neurologist. Those are the people that can really assist you.
All right. Thank you, Dr. Bimi. This is very educative. I am learning a lot, and I hope you are. We're waiting for your questions. Okay, good. We have some questions already,
We
Dr.
are not
Bimi.
really having questions here. We are having comments. I don't know whether there are questions on the watch party.
On the watch party, okay.
For our moderators on the watch party, kindly, if there are questions, please help us to, because we can only see questions drop directly on the video. I have a feeling there may be questions on the watch party that we can't say. So if there are questions, you can, because I've not seen anybody drop.
One thing, Dr. Bimi, this ADHD is not a really known term. I got to know about it, okay, maybe because I'm a teacher, and then we would attend conferences, we've had, to deal with children that we sometimes suspect have these things.
Yeah.
Going on that thing, Dr. Bimi, we had someone talk about the diet of the child.
Okay.
Do you think their diets, affects them in one way or the other? We've had to tell parents, cut down this blood sugar, cut down just to help keep them calm. Does it affect them in any way, or does it really matter?
Yeah. Okay, thank you so much, Okpai. That's a very valid question, and I'm happy that you brought it up because we do get that a lot. And generally speaking, children, the more sugar you pump into them, the more they are hyperactive. And that's one of the reasons why we say parents should do more of healthy diets in terms of packing their children lunch boxes, all these fruit juices, all these juice, so-called juice that we always buy in stores and all that. Most of them are just sugar, loaded sugar. And you see, when you put sugar into the body, it has to be burned up. So that's why the children get hyper kind of when they are on sugar. So ADHD on its own has nothing to do with the diet per se, but you cannot imagine even a neurodevelopmentally typical child, in other words, a child who doesn't have ADHD, if you give them too much sugar, they want to burn it out. So they tend to become hyper. So you cannot imagine a child who already has ADHD, then you now load them with more sugar. And of course, they are going to want to burn off that energy until they become more hyperactive. So usually, generally, healthy choices for children, generally, whether ADHD or no ADHD, is to lower the amount of white sugar or sugary food, fluids or juices or all these products that we normally give them. We need to reduce it. Let them take normal fruits. Let them get the sugar from normal food, not the artificially loaded sugar, products that we tend to give them. So we really need to make sure that that's what we should be doing. So diet should be healthy diets, but not so much, no sugar, no added extra loaded sugar containing product. Yeah. All right. I think we need to have some questions now.
Okay. Okay, this is a question from the watch party.
Yeah.
Thank you very much. When do you refer a child for ADHD for occupational therapy?
Okay, so children with ADHD may need occupational therapy if they have what we call some fine motor issues. And there's another condition that they call developmental coordination disorder. In other words, these children, their handwriting will be very poor. They will not be able to do some activities. Some of the sports activities, they are very clumsy. All that. So the occupational therapy tends to help them with those aspects of their behavior. Now, it's very important, especially for those of us in Nigeria, because we don't have so many of these professionals working with the children. And so because of that, people sometimes they are confused who, and then any child who has any form of developmental disorder, whatever, people just send them to any professional they think they can send them to. And it's very important that people should understand who should be seeing each child. Number one, the first person to see any child with any developmental disorder whatsoever is the pediatrician, preferably a developmental pediatrician or a pediatric neurologist. So those are the ones that should be seeing this children because they need to make a diagnosis. Most of the therapies don't make diagnosis. The therapists manage the children, yes, but they don't usually make diagnosis. And like remember what I said at the beginning, that some of these disorders they tend to look alike. Sometimes they may coexist. So it is important that the pediatrician see the children at the beginning to recommend that because in my profession I've seen a lot of children who have been seen by different kind of professionals and the parents are kind of frustrated and because at the beginning each professional actually in our well, let's just say in a country where things are not very well regulated, you can have this different everybody wants to make their money so they will see the children even if the child doesn't really need to be seen by them, but most time these children require almost all the professionals. So, but the best person to offer see a child with ADHD is the pediatrician. Now, if the pediatrician evaluates the child and the child needs has some motor difficulties, there are some conditions that coexist with ADHD. We call them comorbidities. Like, for example, children with ADHD can also have fine motor difficulties. Children with ADHD can also have sleep difficulties. Some of them can have oppositional deviant behavior. Some of them can have seizure disorder. There are different things, intellectual disability, so many things that can coexist. But the pediatrician is the one that will know this is the original diagnosis, this is the comorbidities, these are the professionals that should be involved. So it is the pediatrician that can now refer, okay, the child needs OT, the child needs speech therapy, whatever. So that's what I would say about that. So your pediatrician will decide when you need to see your occupational therapist.
All right, thank you. I hope you've heard that. Okay, this is another question from Samson Durojai. Is there any tablets for children with ADHD?
Yes, we've mentioned that. So children with ADHD have medications. So we have different medications but these are regulated drugs. These are not even drugs most
Yeah.
doctors will prescribe. It's a specialist that tends to prescribe them. So if you think your child has ADHD, see your pediatrician first, then the pediatrician will recommend the appropriate treatment. And usually those treatment we usually don't give you for more than a month. Then you have to come back because it has to be well regulated so that it doesn't fall into the hand of those who abuse such medication.
Medication. Okay. Thank you, Dr. Bimi. This is from Maureen. God bless you, ma. Thank you. Is ADHD common with DS babies?
I think she meant Down syndrome babies. Okay,
Okay,
so
let's
babies
see.
with Down syndrome can also have ADHD. Yeah, I won't say it is very, very common in them. I think it's just like in any other. Okay, we didn't talk about how common ADHD is. It's affect about 5% of
Yes.
school age children. In fact, ADHD is the most common developmental disorder among school age children, and that is why the teachers are going to pick them up. It's the most common developmental disorders in school age children. So about 5% of children, 5 to 10% of school children will have ADHD. And the truth is the fact that we don't make enough diagnosis of ADHD. We are underdiagnosing, we are under treating the children because most of us, especially in Nigeria, most of those behavior we just say it as the child being naughty, as the child playing pranks, and whereas the child may actually have ADHD. But I think because of our own style of also the way we treat children, I think somehow we are always implementing the behavior strategies, even though we may not know. It's just that sometimes for some children, even with all those behavior strategies, it do not work, and those are the kind of children that will end up needing to see the pediatrician for medication because even with all the strategy teachers are putting in place, they are not working. Because most teachers also know how to use some strategies even without necessarily having a diagnosis that this child has ADHD. They just do their normal teacher. Oh, this child is having behavior. This is how to handle it, and it works for most children. It works, but some children need more than that, and those are the kind of children that will end up being with us. Thank you so much, Maureen, for your question.
Okay. Another question from Oile. Ma, please, my daughter of 12 years has been going through serious tummy pains for weeks now. We have done all necessary tests, including scan. He's referring menstruation. Can it be that? Okay, Dr. Baby.
Yeah, it is
Sorry.
possible. Yeah, even though it's not
Okay,
ADHD related,
okay.
yeah, oh yeah, it's possible. And even sometimes children can have what we call functional abdominal pain, whereas they don't really have any, there's really nothing causing it, but it's possible. So I think you should not just worry, you know.
Worry.
Mm.
Hey, Oyin Goji. I'm wondering if this is related to being very assertive and tendering towards disobedience.
Okay, so
ADHD factor.
yeah, I'm sure you're just joining us. Thank you for joining us. So, like I said at the beginning, we don't just see a behavior and label the child ADHD. You know, I was explaining that that's why it took time to explain that. A disobedient child doesn't necessarily have ADHD. A child who is being assertive doesn't necessarily have ADHD. For us to make a diagnosis of ADHD, the child must have 6 out of 9 symptoms of hyperactivity, 6 out of 9 symptoms of inattention. These symptoms must be present in more than 2 settings, at home or at school, and these symptoms must have been on for more than 6 months, and then these symptoms must be affecting the child academically or in
Academically.
terms of interaction with peers and things like that. And these symptoms, we cannot explain it by any of the other developmental disorders. So there are really very strict criteria for you to make a diagnosis of ADHD. So every child who is assertive will not necessarily, the child may be assertive with you at home, may not necessarily be assertive with the teacher in school, and that may not necessarily affect the child academically. So that child will not be said to have ADHD. So for you to even make a diagnosis of ADHD, it goes beyond the behavior. The behavior must be impairing the child. It must be affecting the child in terms of the child's performance at school. So the child who is underperforming at school, when we do the IQ, the child has very nice IQ scores. But then the teacher gives, and the child is, so these are the kind of children that fail exams. And but when you the teacher now sit down with them, they actually know the work, but because they are very careless, they don't take the time. They are they are distracted. They will not finish the school work, so they will underperform. But the teacher knows that this child has the ability, but the child is underperforming. That this is when you actually make the diagnosis of ADHD, because this is not just a behavioral thing now. It's a behavioral thing that is now impacting and impairing the child's daily life. So that is, so we don't just easily make those diagnoses just because I can't see a child in 5 minutes and make a diagnosis of ADHD. No, we have to make that diagnosis with all the information from school, from teachers, and with all these criteria must be checked. So don't just say any child who is disobedient as having ADHD or a child who is affected. No, we don't do that. Yeah, it must be affecting the child in a negative way for us to say yes, it is ADHD. I don't
Okay,
think
thank you, Dr. Baby.
yeah.
Okay, we don't have any more questions. Please, we're still here. Dr. Baby is still in the house. Don't forget to send your questions, share the videos so that we can have other people benefit from this video. Okay? Dr. Baby,
Yeah.
ADHD. As we're talking, I'm trying to relate with the children I work with, and if perchance we miss that the child actually has ADHD and it's not managed or treated, does it have any other effects besides not coping academically or
Yeah, yes. I'm happy you asked that question. Now, why do we need to talk about ADHD? Why do we need to make a diagnosis? Why do we need to treat these children? Because there is
yes?
what we call, it can have long-term consequences. So most children with ADHD that are not diagnosed, they are the ones that end up doing all the risky behaviors because they are underperforming in school. They end up being school dropouts. They end up experimenting. They are the one that would like to experiment with drugs, smoking, marijuana taking, and all that use of everything. They are the one because of the ADHD tendency. They are the one that will engage in risky sex and they will not use condom or use other protection. They are the one that will likely get pregnant and try experimental abortion. So so when children don't get diagnosed and treated, it
Yes.
will affect them long term. So they drop out of school. They end up being in quotes, miscreants. They end up falling into the wrong groups because they're easily pushed into doing the wrong things. They end up getting pregnant, having abortion. So, number one, their life can be cut short. Number two, they end up, most of these area boys or most of these social miscreants, most of them actually have ADHD when they were in school that were not diagnosed. So if you see the way they behave, you know that they are not able to process things properly. Yeah. So this is the problem with ADHD, because if you don't handle those children, they unfortunately what they end up becoming things that they don't want to be. And even when they become adults, they are the one that will change their jobs. They are fired easily from job because they'll be late to work, they will not meet up with their targets and things like that. And because adults also have ADHD, and if they don't know how to manage it, you see they will be changing jobs and they will not have references. So they will end up having a life that is really not, I mean, that they are not able to get to fulfill their potential. Let me put it that way. And so that's why it's important that ADHD is diagnosed and treated and handled when the child are young, they are still young, when children are young, so that they don't end up becoming, becoming this all these things I've mentioned already. I don't want to use negative derogatory words. So, but it's very, very important. It has very long-term impact, and that is
Effects.
why, yes, and that's why it's important that we handle it right now. Yeah,
This part you just mentioned is very scary. Like
yeah,
sometimes we
yeah.
just
So that's the honest
assume.
truth. Yeah,
Okay, this is from Emanuela. My daughter of 4 months can't stand on one lap. Is it normal or should I be worried?
no, your baby should not be standing at 4 months anyway. So you just let the
It's
baby
too
alone.
early. There's nothing to worry about.
Yeah.
All right, let's keep the questions coming. It's still ADHD and it's still Dr. Benny and it's still an area of specialty. So don't miss out asking your questions. All right, Felicia. This is from Felicia.
Yeah,
Okay,
Felicia,
from the watch
letting
party.
us know you
Please
one
do
day.
kids, yes, you and me. Please do kids outgrow autism or ADHD without medication?
Okay,
Hmm.
now this is very this is a very
Hmm.
difficult one to answer. So generally speaking, in developmental pediatry, we don't talk about the children outgrowing the diagnosis, but we can see that these children can overcome their challenges. I'm trying to choose my words carefully. So if a child has ADHD or a child has autism, it's a lifelong diagnosis. They have that diagnosis. But the children can overcome the difficulties that they have. In other words, so a child with autism, for example, how do we make diagnosis of autism? The child has difficulty with communication, social interaction. The child can learn to talk, the child can learn to socially interact.
To
So the child
relate.
has overcome all those difficulties. But the child will still have the diagnosis of autism. They may still always have some features once in a while, that help you to know that but they can manage it,
Physical
they
with
can
autism.
control it. The same thing with ADHD. Somebody with ADHD can learn how to manage themselves, they can learn how to control themselves, they can learn how to do things properly, and they may not need medication. Yes, they don't need medication, but they will always know that, oh, I have that ADHD tendency, but I just have known how to manage it. So if is that what you meant by outgrow, yes, then you can say yes. But it is important for them to know that they have this diagnosis and they are still putting in all those measures to deal with these challenges that those who have those diagnoses may have. That's very important. But they can actually outgrow or overcome their challenges. That's the way I like to put it.
Challenges. Okay. All right, thank you, Dr. Benny. This is from Allow. Please, my girl child of 2 years has not started talking. Please, is this normal? Okay, Dr. Benny, 2 year
Yeah,
old.
it is not normal for a 2-year-old not to be talking.
So
A
it's
1-year-old child
age.
should have 1 to 3 words, and a 2-year-old child should be putting two words together to form phrases like mommy, cake, mommy, biscuit, this kind of thing. So if a 2-year-old is not talking at all, then it's important that you take that child to see either a pediatrician or a speech therapist. Number one, we need to offer evaluate the child, and then most likely it could just be speech delay. Some children have speech delay without any other thing, then the child will need speech therapy. Sometimes the child may have autism. So one of the most important things to rule out in a 2-year-old who is not talking is autism spectrum disorder. We need to really rule it out. So that's the first thing to do. And if there is autism, then we can start early intervention for the child. So allow me, I will encourage you to see, you can see your pediatrician, then your pediatrician can do, excuse me, can do the appropriate referral for you. Thank you.
All right, thank you, Allow me. I hope you've heard that. Okay, do we have more questions? Okay, as we're going through today's topic, Dr. Benny, I just remembered I had a friend back in school. She always had this tension ball or pressure ball, I don't know. And she was
Yeah.
just, it's around her, it's everywhere. Like
Yeah.
and she's so smart, she's very intense. She hardly talks, but when she gets angry, she can destroy the whole house. So she said she went for therapy and then they just told her to keep squeezing the ball when she's angry, breathe, and it helped her. I mean, throughout the 4 years in school, she didn't act up. You know, can we say she had ADHD or it was just an anger issue?
It's so hard to
Just
say because I can think of possible things that she has, but it would be unfair to say what she has without having all the information. But I would think most likely it's possible she is on the autism spectrum. Yeah, so because literally they have this um, they may have some sensory processing difficulties, and that's why they need to have things like balls, something they can hold in their hands and things like that. But it's so hard to say what it is without, because you are only reporting what you know. There are maybe other things
yeah,
that you don't know,
around.
so we can't make a
So,
retrospective
so,
diagnosis. I can only assume that maybe she may be on the spectrum, but it's not every child with autism spectrum that is very not talking or not interacting at all. It's a spectrum. So some people on the mild end of the spectrum, you will not even know they have anything wrong with them, but you just notice that there's a little bit some awkward way they do their things, but they are still they will still function properly. I'm just assuming, but it's difficult to say what it is. Okay, I think our time is almost up, so we have just two more questions. Then we'll take that, and then
say,
we can we can close the show for today. Yeah.
okay, this is from you, and Vanessa is 4 and she's at party. She has normal growth and she has speech delay and screams a lot. My question is this: is she autistic or having ADHD? She's
Okay.
4. Four.
One day I cannot make a diagnosis just based on those three
What you
sentences
have
like
said.
briefly. It's very important. I have an idea of what is to be wrong. I will think more of autism, like I told was an Okpa at the beginning of the program, that if a child has speech delay, it's a very strong flag, a red flag for
Okay, so,
more of
yeah.
autism. A child who has speech delay, who is now screaming or having all those behavioral issues that I talk about, we need to refer for evaluate for autism. Usually, children with ADHD have normal development. They don't have any speech delay. In fact, they talk too much and they interrupt people's speech and all that. That's even their own. You can't get them to keep quiet. So I would rather think more of that. But like I said, a child can have both autism and ADHD as well. So one day, I really think you must see a pediatrician. Your child must be evaluated, and your child must be treated properly. So if you have not started, you didn't tell us how old your child is and things like that, but I
Except
really
for
think you should get your child evaluated properly. If you are in Nigeria, you can send us a message, email or something that we can see where we can refer you to. If you are in Lagos, you can go to Luz. At least we do some assessment there. Some other, I think, some other centers also do. Some of the centers that do treatment for the children also do assessment as well. But any of the teaching hospitals, preferably Luz, at least I can speak for Luz because that was where I was working before. They will be able to assess your child for you. Okay, our last question for today.
okay, this is for Blessing Adezi. This can we have the questionnaire for ADHD on the group page? Dr.
Uh,
Benny.
the questionnaire for ADHD, some are in public domain, some are not in public domain. But it is not, the questionnaire is not even the problem. Having the questionnaire doesn't make any difference because it has to be interpreted by a pediatrician. So even if we put the questionnaire for you, doesn't mean we are not, you can't make a diagnosis just by filling the questionnaires. The the pediatrician has to collect the questionnaire from the school, from the teachers, and have to interpret it. But if you want to get a hold, you can just go that you can search for ADHD questionnaires, Vanderbilt questionnaires. I think the one by the American Academy of Pediatrics, AAP. They have the Vanderbilt. I think it's available. Is in public domain. You can just use it. But I'm not sure whether you can interpret it online. So you can just go. There are a lot of. There's also Shard. There's a lot of websites for parents about ADHD. So if you want to get trained on these questionnaires, but filling the questionnaires require a clinician who will coordinate everything and arrive at the diagnosis. All right, but it's available. I think some are in public domain. Even if you just want you to have an idea of what I'm talking about and how to make diagnosis, yes, it's fine. You can check it out. Just one debit questionnaires or just Google ADHD questionnaires. You will come across some of them and you have an idea. Okay. The last one.
Okay. My question: my daughter of 1 year 3 months can't walk yet, can't talk, and have 10 teeth. Is it normal? 1 year 3 months.
You said can talk. Hey, 1 year 3 months not working.
Can't walk, but yet can't talk.
Yeah, but your baby is fine. There's nothing wrong with your baby. Usually, if your baby is not working by 18 months, then see a pediatrician. Usually, we will not worry until the baby is 18 months.
18
Okay,
months.
fine. We're done for the day. So, thank you so much for everyone who joined us this morning. We've talked about ADHD, attention deficit hyperactivity disorder. I just want to say that parents, if you think your child has any developmental disorder generally, please don't be in denial. Generally, for developmental disabilities or disorder, the earlier we make a diagnosis, the better for the children. The earlier we start intervention, the better for the children. And like Ope was asking me, and I rightly said, the long-term consequence of these undiagnosed conditions can be very disastrous. We don't want these children, actually, when they get to the teenage years, children with ADHD in the teenage years, they are not on treatment, they are not on any form of support, they tend to have lots of difficulties. They are the one that will experiment with drugs, they're the one that will experiment with smoking, they're the one that end up in school dropouts, they are the one that can get sexually transmitted infections and things like that. So we really need to make sure that it doesn't have to be drugs, even if it's just the behavior management, they need them. They need all this support. So it is very, very important that we get them all the right support. So if you think your child, based on all this discussion, may have ADHD, kindly take them to see a pediatrician, preferably in any of our teaching hospitals, and then they'll be able to give you the right support, make a diagnosis. If it's just behavior management, they will tell you. If it's required medication, don't be scared of the medication. They will monitor the medication, they will monitor the side effects. And then the most important thing, and like I said, if the children overcome these challenges, they may not need to take the drugs for life, and they can be out of the and they can be able to function as responsible citizens and responsible adults. But they really need to have the right diagnosis and the right approach as soon as possible. So thank you so much. Yeah, that's my take-home message.
All right, thank you, Dr. Benny. It's been a very, very educative one. I must confess, I have learned a lot, and I'm sure you have. And I hope and pray that we'll be able to work and deal with these things when we need to as fast as possible. Dr. Benny, final words before we go.
Yeah, just to say that thank you so much for everyone who joined us this morning. We apologize a little bit of technical itch at the beginning, but we overcome that. If you after the live show, because some people will come and watch this video after the live show, please drop your questions for us on our group, not under the video, because after we cannot easily come back to answer questions drop after the live show. So if you have questions on ADHD or questions generally on anything child health issues, go to our group. If you go to Facebook and just type Ask the Pediatricians, you will see Ask the Pediatrician Facebook group, and then you can we'll be able to answer. You can drop your question there. I can see Oyelia here saying we've not answered your question. I'm not sure we've seen your question. Maybe your question didn't drop. If your question didn't drop, you can now take it to the group. It'll be easier for our moderators and our professionals on our group to answer your questions there. So kindly go to www.facebook.com/groups/ask the paid. When you get into the group, join our group, then you can drop your questions. You will get immediate and faster response to your questions. And also on our pages, as much as possible, we don't want you to be dropping questions on the page or on the videos or on our pictures, because it's very difficult for us to track those kind of questions. But if you go to our group and you drop your questions there from Monday to Saturdays, we answer your questions 24 hours. We are online to answer your questions. We don't answer questions on Sunday. And so so don't be frustrated if you think, oh, I can't drop questions on Sunday. We don't answer questions on Sunday, but Monday to Saturdays, 24/7. 24 hours on those days, you can drop your questions and we answer them. And if you have an emergency, please don't drop questions that are emergencies. Such questions, please take it to the hospital. We are an health education platform, an health information platform. We don't treat children. We don't make diagnoses. We don't handle emergencies. I mean, you also know that it's impossible for us to do that on a online
Online.
platform. Yeah, so kindly take your children to the hospital in such instances. But thank you so much. And if you want to support Ask the Pediatrician Foundation, if you want to advertise on our program, you're welcome. If you want to sponsor ETP Live, you're welcome. Just send us an email at askthepediatricians@gmail.com. Askthepediatricians@gmail.com, and we will tell you how you can be part of this program, or how you can support us, or how you can advertise on our program. And if you want to watch our past videos of all the ATP Live we've done previously, we have a YouTube channel. So you go to YouTube and look for Ask the Pediatricians. I think it's www.youtube.com/Ask the Pediatricians. It will land you in our Ask the Pediatrician channel, and you can watch all our videos. You can also watch it on our page. You can watch it on our groups. But I think if you don't want, you just want the video itself, you can just go to the YouTube. Kindly subscribe to our YouTube channel, and you watch all our previous ATP Live videos, and you can learn a lot from it. So thank you so much for joining us this morning. I'm being Have a nice weekend.
All right. Okay, thank you, Dr. Bemi. Enjoy your weekend. Thank you, everyone, for joining us.
Yeah.
Enjoy the rest of your weekend, and see you next week at 10 a.m. Bye-bye.
Bye.